I'm here today to describe a simple way for you to cut your risk from dying from a silent killer, colon cancer. A great deal is known about the genetic causes, early detection techniques, and treatment options for colon cancer. There are only a few facts you need to know to stay safe. Not everyone gets colon cancer, but it's difficult to know who will and who won't be affected. Colon cancer arising from colon polyps is a very common cause of death in our country. 25% or more of Americans over 50 have a colon polyp at their first colonoscopy. As a group, we have a 6% lifetime risk of developing colon cancer. 150,000 new cases of colon cancer are diagnosed every year, and it kills 50,000 people in the U.S. yearly. That's a new diagnosis every 3.5 minutes, and one death every 10 minutes. For colon cancer, the odds are not good, and the stakes are very high. Playing bet your life when there's a 6% chance of losing is simply not smart. Before I tell you the simple way to cut your risk, I would like to share some background information with you. Inside your abdominal cavity is the long tubular digestive tract or gut. The second part of this tube, the large intestine, is composed of the colon, which is about 6 feet long, and the rectum, which is about 6 inches long. The colon is needed to absorb and recycle the large amounts of digestive juice, which the body makes every day, and to hold the waste products from the digestive process until they're eliminated. The colon's a good organ to have, although if you need be, you can live without it. The inner lining of the large intestine is prone to develop growths or tumors called polyps. Polyps form because genes in those cells have mutated, causing loss of the normal controlled growth pattern. After a polyp forms, it may continue to grow, allowing more mutations to develop. If the genes in polyps mutate too much, a cancer will form. The cancer cells then can spread through the intestinal wall, eventually using the bloodstream to reach other parts of the body. Once the cancer spreads to lymph nodes or other organs, successful treatment becomes more difficult. Depending on how advanced the disease is, 5-year survival rates range from 9% to 93%. On average, 40% of people diagnosed with colon cancer do not survive 5 years from time of diagnosis. Colon polyps are very common in our country. In fact, about 25% of Americans over 50 will be found to have a polyp at their first colonoscopy. While most polyps are benign or non-cancerous, when detected, many do have the genetic mutations making eventual cancer likely. The microscopic appearance of the polyp and size of the polyp are correlated with the development of cancer. Fortunately, removing the polyp prevents that polyp from going on to cancer. Unfortunately, people that have developed certain types of polyps have a higher chance of colon polyps and cancer in the future. Like many cancers, colorectal cancer is of particular concern for people older than age 50. Although diagnosis is often possible at an early stage, many people delay seeking medical care because they're embarrassed or fearful of symptoms related to their bowels. Our risk increases significantly after age 50 and continues to increase with age. Colon cancer has no symptoms until it's far advanced and difficult to cure. Waiting until you feel sick to take action will not save your life. Colon cancer is a silent killer, and if you wait for warning signs to act, you'll need a major operation and may have to have a colostomy, which is a bag, or chemotherapy once the cancer spreads to lymph nodes or other organs. Curative treatment becomes less likely. If you want to avoid colon cancer, you must act before you have any symptoms. That's why I'm glad you're here with me right now. The good news is that colon cancer is usually preventable. It almost always starts as a detectable tiny growth, which takes years to grow, become cancerous, and then spreads. This means that the growth can be removed before it becomes cancer. There are several ways to detect the polyps which lead to cancer. These include X-ray tests, CT scans, and stool tests for hidden blood or genetic material from polyps and cancer. But because it both detects and removes polyps, colonoscopy using a lighted, flexible instrument inserted under guidance is the best procedure to prevent colon cancer. And preventive screening colonoscopy is covered by insurance for most people 50 and over. What does this mean? Prevention is paid for. You absolutely want to optimize your tests for best results, so here's how to get ready for your examination. Colonoscopy is a visual test. In order to see and remove the polyps, your colon must be totally clean at the time of the appointment. The colon is not capable of keeping itself clean, so timing is everything. This does take some planning, but it's not difficult. Here are the steps. Step 1. Set up your appointment for the colonoscopy itself. This must be on a day you are not scheduled to work. You will not be able to operate a motor vehicle the day of the test. You should have a trusted companion accompany you home. Make arrangements to have a driver. You may need to start taking the laxatives on the afternoon before, so plan on that time as well. Step 2. Plan your medicines. Medicines that interfere with blood clotting increase the risk for removal of polyps. You will need to follow your doctor's advice on taking these medicines. Oils, especially fish oil and mineral oil, will stick to the lens of the scope. Do not take these for 3 days before your test. Step 3. Purchase the bowel preparation your doctor has prescribed. Make plans to when you will start taking it and where you will be. The laxatives work quickly, so make sure you can stay at home once you start taking the medicine. Step 4. Plan your diet. Seeds and fiber will interfere with the bowel cleansing process. Make sure you do not eat foods with seeds or vegetable fiber the 3 days before your examination. Avoid red and purple colored drinks. The red color looks like blood and makes the procedure difficult. Step 5. Take the bowel preparation as directed. There are different preparations, but all require split dosing. Some laxative the afternoon or evening the day before, and some laxative about 6 hours before the test itself. Step 6. You can take blood pressure medicine and heart medicines the morning of the colonoscopy with a small amount of water. Do not eat or drink anything else for a minimum of 4 hours before the examination. On the day of your colonoscopy, you'll come into the surgery center or outpatient hospital center where you'll be made comfortable on a stretcher bed and an IV will be placed. You'll be taken into the procedure room and will be given sedation. This will allow you to sleep through the procedure and be comfortable. After the procedure, you'll be awakened and you'll be allowed to leave with the person who accompanied you to the hospital or center. Now a few words about who will do your examination. Many doctors perform colonoscopy. Some have learned at university hospital-based training programs or fellowships requiring years of study under specialists after completing standard residency training programs. These physicians, known formally as gastroenterologists, typically limit their practice to intestinal problems. They keep current on the latest treatments and perfect their skills with practice. Other physicians who perform colonoscopies have learned during their standard residency programs, studying 1 to 2 months under physicians who treat a much broader range of conditions at community hospital-based training programs. These physicians, such as general surgeons and family practice physicians, do not generally limit their practice to intestinal problems, so intestinal problems make up a small part of their practice. Any of these physicians can do a good job of performing colonoscopy for most of their patients. A minority of patients will have an unusual lesion or a polyp that's difficult to remove with a colonoscope. These patients benefit from having the most experienced, highly trained professional doctors do their examination. They can help to limit the risks, which include perforation of the colon, bleeding, and possible infection. Each of the physicians at GCPC has had years of training at University Hospital Gastroenterology Fellowship programs after completion of a 3-year internal medicine residency training program. On average, they each perform 1,000 or more colonoscopy exams each year. Their average adenoma detection rate, a measure of how thoroughly the colon was examined, is 30%. The national benchmark, 25%. Their average cecal intubation rate, a measure of performing a complete examination, is 99.8%. National benchmark, 95%. Their overall rate of perforation is less than 4 in 10,000 cases. National benchmark, 10 in 10,000 cases. If you want to do one thing right, devote your time to doing that one thing. The motto at GCPC, you can trust your gut with us.